Huntington's disease can also go by the name Huntington's chorea and hereditary chorea. It is a fatal neurodegenerative disorder that is relatively rare. It affects about 30,000 people in the United States. Huntington's is more common in Europe, specifically throughout the United Kingdom. Huntington's is an autosomal dominant disorder, so only one parent has to have the gene to pass it on. The chromosome that holds the Huntington gene is 4p16.3. This means that it is at position 16.3 on the short arm of chromosome number 4. There are typically repeats of a trinucleotide of this gene. The trinucleotide is CAG, cytosine adenine guanosine. In the typical gene, there are anywhere from 6 to 35 repeats of this trinucleotide. In Huntington patients, however, there are anywhere from 36 to 250 repeats. The more repeats, the earlier that the onset of Huntington's will begin. This is why the median age for the onset of Huntington's is about 40 years old, but there are cases of juvenile Huntington's. At 27 to 35 repeats, which is still technically at the high end of normal, there can be an increased risk for gene instability. This gene instability is what leads to the expanding trinucleotide repeats leading to Huntington's. Huntington's disease is an example of a disorder with incomplete penetrance. At the low end of abnormal, with 35 plus repeats, only some of the individuals may experience Huntington's. Some individuals could be fine, and just more likely to have a child with Huntington's. At 40 plus repeats, it is almost sure that the individual would get symptoms of Huntington's. The genetics of this disease are not very discrete. A person who has Huntington's has a 50-50 chance of passing it on to their child, because the child could be homozygous recessive for this gene. An interesting fact about Huntington's is that when the gene gets to the point of above 35 trinucleotide repeats, the whole gene is no longer inherited in a Mendelian fashion. It is then considered a non-Mendelian inheritance. This disease is characterized by a slow decline in physical and then mental function. The physical movements can either be rigidity or chorea, which are short, jerky movements. The physical symptoms can continue until the affected person is unable to do daily tasks by themselves and may even have problems breathing and swallowing food. Later on, the patient begins to experience dementia and other deep cognitive issues. There are differences between how the disease progresses genetically when it is the mother or the father passing it on. When a mother passes it on, the gene is more prone to both expansions and contractions. Either of these variations in a trinucleotide repeat would not be by many. It would be by 1 to 3 at the most. With the father passing on the mutated Huntington gene, however, it is more prone to expansions, and this can be greater in number, up to 10 or more. There is no cure for Huntington's. The only help that sufferers of this disease can get are medicines and therapy, but there is nothing that can slow the progression or the onset of this disease. With stem cell research that is going on now, researchers are hoping to find some way to help the sufferers of this disease. Tetrabenazine is one of the pharmacological drugs that is marketed to help with the movements associated with Huntington's. Occupational, speech, and physical therapy are all non-drug-related methods of management for this disease as well. When someone is diagnosed with Huntington's, they are usually given 15 to 17 years to live. There is no road to recovery for these individuals, and that is why the third cause of death for Huntington's patients is suicide. This disease is a good example of a fatal, incompletely penetrant, expanding repeat autosomal dominant disorder. It is rare enough that under normal circumstances that you might not meet more than one individual with this disease in your lifetime. With stem cell research, researchers have begun to grow pluripotent stem cell lines from skin cells of a patient with Huntington's disease. Through all of the suffering that these individuals face, the cure for this disease is on the horizon.